Well, today it might be a review for you, but we are just talking about, some GI health and
Mhm.
stomach acid and what is it? Is it good? Is it bad? Do we need it? Do we not need it? So we'll kind of take it back a notch a little and just talk about stomach acids. Your stomach is meant to be an acidic environment. It kills the bad bugs. It aids in proper digestion and absorption, and it stimulates the release of pancreatic enzymes to help us absorb those carbohydrates and nutrients and fat. And so if we don't have that, then we could be in trouble. The thing with stomach acid is it slowly declines as we age. So a 40-year-old has about half as much stomach acid as a 20-year-old. And then you take on top of that the impact that diet can have, the impact that lifestyle, poor lifestyle choices can have. We've got so many patients on medications like PPIs and things that suppress stomach acid. So the question is it good? Is it bad? So stomach acid in the stomach is good. We need it. There's a purpose to it. We have to have it. Stomach acid in the esophagus is bad. So we don't want that. And so, the conventional medicine solution is decrease stomach acid everywhere, right? Just
Mhm.
go, we have a little bit of esophagitis and we just decreased everywhere. So we're not
Mhm.
really looking at the diet. We're not really kind of targeting that patient's specific approach and what caused that imbalance to begin with. So functional medicine, we're really focused on identifying the reason that that acid kind of went awry. So, stomach acid in general, we've got the esophagus, and then we have the stomach, and then you have this little flap in between called the lower esophageal sphincter, or LES. And that separates the stomach from the esophagus. So it's kind of this round muscular doorway that prevents acid reflux into the esophagus. If there's a faulty door there, if that's faulty, then you can have that reflux. So that sphincter is always closed except for burping and swallowing. When relaxation occurs, that's when you can have that reflux at inappropriate times. So things that can cause that relaxation would be alcohol, chocolate, stress, cigarettes, or any type of nicotine. So if left untreated and you've got this faulty door that's allowing this acid reflux up into the esophagus, which is where it doesn't belong, that can lead to ulcers, scarring, constriction, and sometimes even in severe cases, things like a Barrett's esophagus or esophageal cancer.
Mm.
So we don't want that. But again, we need it in our gut. A couple stats, 44% of Americans have some sort of heartburn at least once a month. So again, that's a big percentage.
Mhm.
After heart disease and diabetes, gastroesophageal reflux is the third most expensive condition when you encounter like medications, procedures, workups, scopes, all that. So the symptoms of acid reflux are heartburn, coughing, throat clearing, where you just kind of constantly feel like you're having to clear your throat, trouble swallowing. You can even have dental erosions. And there's a link between GERD and IBS. And so, what causes GERD? So, we've often heard of, the full stomach. If you think of pregnancy, a lot of pregnant women will have a little bit of acid reflux because they've got all this pressure pushing up
Right.
on that diaphragm. So, full stomach, big meals, you can have acidic foods. So, things that are fried, spicy, acidic, again, alcohol, caffeine, because all of that relaxes that doorway. If you think about, someone goes out and they have been drinking all night and then they say I tend to snore after I drink. Well, that's because that alcohol is relaxing that sphincter. You're laying down. And then eating too close to bedtime as well can exacerbate that. Those are the common things that we hear about. But what we don't hear about is magnesium deficiency. We know that magnesium helps to relax that sphincter that, again, that separates the esophagus and the stomach, and it allows food to go down at the proper time. So it's a good relaxation that we want to occur. If we have deficiency, then we can have that backflow. Poor eating. So if you're eating too fast, you're not taking a breath or eating in a rush state, that can contribute. High sugar, processed foods, H. pylori is another common one. It's a bacteria that can be linked to GERD. Poor gut health. So any type of bad bacteria or yeast can worsen acid reflux. Slow thyroid, food sensitivities, stress is a big one. High cortisol can actually drive an 80 to 90% reduction in stomach acid. So it impacts the nerves in your stomach because, our stomach has its own nervous system, and it makes it more difficult to digest food because we're not in that rest and digest, that parasympathetic. We're in that fight or flight, go, go, go. So stress, decreased digestion. The most common cause of GERD is low stomach acid, not high. And people are like, wait, I thought high stomach acid caused regurgitation and GERD. So what happens is if you have low stomach acid, you have a harder time absorbing those nutrients, carbohydrates. So you've got malabsorption of fats and carbohydrates, and then you've got more chance of bacterial overgrowth, the bad guys. So the bad bugs can come in. When you have those bad bugs and poor digestion and malabsorption, you get intra-abdominal pressure. And then that is going to cause that acid reflux. What else causes low stomach acid? So we know age, we've got a declining number there just with age. We know stress, we know poor diet, antacids or any type of medications that can potentially lower the stomach acid, poor gut health. And what happens, and I probably shared this story before, but my husband is an example. He would have acid reflux, probably wasn't on the cleanest diet. And then he would go to his PCP, they would order a scope. He had the scope done and they said, yeah, you have a little esophagitis. Here is your Prilosec or, whatever med they put him on. And you'll be good. No mention of follow-up, no mention of, how long you're going to be on this, because those medications, while they are needed in some cases, they are not meant to be long-term. They can interfere with, nutrient absorption and fat and carbohydrate absorption and lead to some of these issues, even worsening gastrointestinal imbalance in acid reflux. So osteoporosis. So they're just not meds that are meant to be long-term, unless, of course, it's a specific case, like a Barrett's esophagus or something where they are really high risk. And but those cases are far and few between. Most cases are just, because of the conditions that we're not addressing. Poor lifestyle, poor diet, poor digestive health, etc., stress. So some actionable steps that we can take to really eliminate or minimize this gastrointestinal reflux are eat when you're hungry. Do not overeat. You do not need this, 12-course meal. Avoid those trigger foods. So if the fried foods, the spicy foods, the acidic foods, alcohol is a trigger for you, then you're going to want to, modify your diet. Smoking, alcohol, caffeine, we know that's a known trigger. For some, it's about losing weight. And so we can, work with patients individually to accomplish that goal. You want to try to avoid eating about 3 hours before bedtime. Supplementing with magnesium is also highly beneficial. And also making sure that you're well hydrated. That is a big one that most people don't think about, but that is the large part of prevention. And then avoiding any high sugar processed foods. Eating in a relaxed state, so you don't want to rush through your meal. A lot of us, we're just so used to go, go, go. We can't do that. We really are meant to, if we really want to focus and optimize digestion, we really have to be in the right mindset. So I tell patients, when you sit down, before you even eat, take a few big deep breaths and just try to kind of relax, be in the present, and focus on your meal and all the good that it's bringing your body. I usually say try to start with a salad, and then that starts to stimulate those digestive enzymes. And by the time you get to your protein, your enzymes are already kind of kicked up a notch. And so they're a little heightened. Dental hygiene is really important. So making sure we're addressing any type of dental issues is key. Addressing any gut bugs like the H. pylori I mentioned. So if need be, we can do, advanced stool testing. Sluggish thyroid needs to be addressed. Food sensitivities need to be addressed. So potentially an elimination diet or food sensitivity testing is good. And then of course, just stress reduction, breathing, meditation, all of that, again, takes us into this parasympathetic place which we need to be when we're focused on digestion. So some supplements that can help, again, magnesium is one. Ginger is very helpful. Probiotics, prebiotics, sometimes digestive enzymes if that's required. And that's where that stool testing comes into play, because we're able to see those intestinal health markers to see, where you are and actually quantify how your pancreas is doing in terms of supporting. And then sometimes we do need some hydrochloric acid. Sometimes we just are so deficient that is what we need to replace. Apple cider vinegar is very helpful, as well as sometimes you can do like a glutamine or aloe licorice blend for any type of reflux. And then, as I mentioned, there are special considerations. So if it is someone who has ulcers or Barrett's esophagus, certainly, esophageal cancer, those are all a separate specialty that should be dealt with in a very specific manner with an gastroenterologist. And so those would not be patients that I would be messing with their PPIs or medications for acid reflux. When someone does decide to come off of that, though, and we've discussed it on the right setting, we do have to make sure that we're weaning those patients, because if you've been on them a long time, and even if you haven't, you come off those, you can have some rebound reflux. So that is something to think about too when those patients are on those medications for a while. So there's a lot of benefit to hydrochloric acid and proper acid in our stomach. We just don't want it in the wrong place. It's kind of like, if you've heard of SIBO, small intestinal bacterial overgrowth, we need these good bugs, just like we need hydrochloric acid. But the good bugs, we like them in our colon, in our large intestine. We don't want them to creep up into the small intestine, because that can cause gas and bloating and indigestion. Same thing with hydrochloric acid. We need it to stay where it belongs and where it should be.